Myositis. We see something about myositis. It is mainly attacking the immune system, and mainly muscles will be getting affected. And when the person is affected with the myositis, they will feel that a hard time moving or using the affected muscles. And overall, there is no exact cure for myositis, but in some cases, we can give treatment for put into remission. Myositis. Myositis is a disease that makes the immune system attack the muscles, and it will cause a chronic inflammation, and swelling comes over the long time. And mainly it will be affecting the joints, and the joints, the person will be develop swelling in the joints, and the inflammation makes the muscles feel increasingly weak and cause muscle pain. What causes myositis? So there is no exact cause, and it will be caused by its own. And even some conditions may be triggered, that is autoimmune diseases or the result of immune system accidentally. The person's own immune system will be attacking the own body instead of protecting it, and actually we are not aware about the cause why it's happening. And some people with autoimmune diseases are more likely to develop myositis. Example, systemic lupus erythematosus. The people those who have already having any type of autoimmune diseases, very often they will be affected with the myositis. That is with lupus or rheumatoid arthritis or scleroderma. And coming to the types of myositis, so the myositis, the types we will differentiate based on the symptoms we present the time of assessment. And few different forms of myositis, that is polymyositis, dermatomyositis, inclusion body myositis, juvenile myositis, and toxic myositis. What is polymyositis? So the polymyositis affects the multiple muscles at the same time, and the symptoms usually include the muscles or near the center of the body. And the polymyositis develops gradually over time, and mainly it will be affecting the adults. Women and people assigned a female at birth are twice as likely to develop polymyositis than men. And if you're seeing anyone having polymyositis, they will be having a very difficult in performing movements like standing up after sitting, climbing stairs, lifting objects, and reaching over the head. Second one is dermatomyositis. Dermatomyositis is a form of myositis that affects the skin. So that is derma itself. We know that it will be affecting the skin, and it will take months to develop. And dermatomyositis sometimes it will be developed quickly. And if you are very fast, if you are starting the treatment, we can avoid the complications. And the next one is inclusion body myositis. It's a degenerative muscle disease, and mainly it will be affecting the people above 50 years of age. And the main symptom we can assess the patient with inclusion body myositis, that is muscle weakness in the extremities, that is mainly in the hand and legs, below the knees, and even the people may be having the difficulty in swallowing. It will be affecting the throat. And 30% of people with inclusion body myositis, that is developing this stage, people will feel difficulty in swallowing. And the next is juvenile myositis. Juvenile myositis mainly occur in children under 18 years of age. And if you're comparing with the boys, girls are twice develop juvenile myositis than boys. And juvenile myositis is characterized by muscle weakness and skin rashes. And the final one is toxic myositis. The word itself, we know that toxic myositis is caused due to some toxins which is entered in the body, and mainly it will be caused due to certain medicines that will be, the medicine itself will be acting as a toxins. Mainly cholesterol lowering medicines, that is anti-cholesterol medicines like atovastatis. So these are the common medicines which will be causing a toxin which enters into the body and develop toxic myositis. And coming to the pathophysiology, that is how it's occurred, that is polymyositis and dermatomyositis. So initially it will be occurred due to the genetic factors, that is both human leukocyte antigen and non-human leukocyte antigen. And this human leukocyte antigen or genes is a major histocompatibility complex that help code for proteins, and mainly it will be differentiate between self and non-self. And these genetic factors combined with the environment, that is infection, toxin, and ultraviolet light. Infection results from some contagious spread from adjacent sites of infection, and the toxins by some bacteria, and ultraviolet light inhibits antigen presentation. So all these will be causing a immunologic danger. So these genetic factors and the environmental factors results in immunologic danger. So what is immunologic danger? So if you have any autoimmune disease, your immune system attack the healthy cells in the body by mistake. So that will be caused in the immunologic danger. That will be results in the increased MHC cells. So the increased MHC cells 1 and 2. So here the MHC cells or the cells consist of linked set of genetic loci encoding, and mainly it contains the proteins involved in antigen presentation to T cells. So it will lead to myositis. And even that innate immunity, that is dendritic cells and macrophages, that is tissue cells and adaptive immunity, that also combined will be causing that myositis. And even the non-immune cells, that is ER stress autophagy, that is accumulation of unfolded proteins in the endoplasmic reticulum, will be causing the myositis. Coming to the symptoms of myositis, the patient will be having muscle weakness, joint or muscle pain, fatigue, swelling, trouble breathing or swallowing, arrhythmia, and it will be mainly affecting the heart. How is myositis diagnosed? So the healthcare provider will diagnose myositis with a physical exam test, and physical examination patient will be exhibit any of the following. Mainly they will be having weakness of the shoulder or hip muscle, and in case the patient present of dermatomyositis, particularly skin findings will be there, that is patchy reddish rash on the knuckles or eyelids or indicative of dermatomyositis. And in blood test, there will be a sign of damaged cells. You can see inflammation, and even the blood test, there will be presence of antibodies, which are tiny proteins which will be attacking the patient's own body cells. And antinuclear antibody test is a test to see the person has antibodies that attack the central part of the cell. That is, we know that central part of the cell, the nucleus is present. And other autoantibody tests include ENA, that is extractable nuclear antigens, and anti-Jo1 test. This test will be positive if the patient is having myositis. And MRI will be helped to work out where the inflammation and where the muscles have the inflammation and where exactly the damage is present. And electromyography is a diagnostic procedure mainly to be evaluate the health condition of muscles and nerve cells. And even we can perform the muscle biopsy. So it is a procedure that removes a small sample of tissue, and it will be sent for cytological examination in order to rule out whether the patient has any infection or disease in the muscles. How myositis treated? So exactly there is no cure for myositis, only we can reduce the symptoms of the patient, and the goal of treat symptoms maybe goes into remission when there is little or no inflammation. So the mode of treatment that is mainly we will treat with the corticosteroids, immunosuppressant and intravenous immunoglobulin. And corticosteroids is the first line of treatment, so mainly will be used for dermatomyositis, polymyositis, and necrotizing myopathy, and even juvenile myositis. So the drug of choice is prednisolone 5 to 10 mg we can give. It will be slow the body's immune system and stop the inflammatory attack of the muscles. And mainly it will be control the inflammation so that the patient's pain in the muscles will be reduced. And the doses will be very depend upon the patients, that is severity of the symptoms, weight, age, all the things we will look for, and we will be categorizing the dose and decrease the dose very slowly if the patients have the improve in the symptoms. Second, immunosuppressants. So the immunosuppressants often introduced second line medications, and even we can give combination of prednisolone. So if you are starting immunosuppressant, better we can taper and reduce the dosage of prednisolone. So immunosuppressant include methotrexate, azathioprine, mycophenolate, mofetil, cyclosporin, tacrolimus, and cyclophosphamide and hydroxychloroquine. The final one is intravenous immunoglobulin. Intravenous immunoglobulin is a therapy treatment for patients with antibody deficiencies, and it is prepared from a pool of immunoglobulins, that is prepared from antibodies from the plasma of thousands of healthy donors. And immunoglobulins are made by immune system of healthy people to fight against infections. And exercise and physiotherapy. So the exercise is it should be a planned regimen as per the directions of the physician, and even the aerobic exercise we can insist the patient to do, because it will make breathe more heavily, and which makes breathe properly, and it will be helps to restore the muscle strength, because the thoracic cavity will be expand and it will be push the diaphragm downwards so that the patient can breathe normally. Thank you.